Welcome to Dr. Health Hub. Today's topic is something many people don't like to talk about, but it's very common: diarrhea. Have you ever had a day where you felt weak, ran to the toilet often, and just wanted it to stop?
Yes, diarrhea is one of the most common health problems worldwide. In simple terms, diarrhea means passing loose or watery stools more frequently than normal. Most cases are short-lived and clear up within a few days, but sometimes diarrhea can be a sign of a more serious problem.
So, doctor, what usually causes diarrhea?
There are many causes. The most common is infection by viruses, bacteria, or parasites. For example, norovirus and rotavirus are viral causes. Contaminated food or water may carry bacteria like E. coli, salmonella, or parasites like Giardia. Other causes include food intolerance, such as lactose intolerance, side effects of medicines like antibiotics, or digestive conditions such as irritable bowel syndrome, celiac disease, or inflammatory bowel disease.
So, sometimes it's just a stomach bug, but sometimes it's linked to a long-term condition. What symptoms should people look out for?
The main symptom is passing loose or watery stools several times a day. But diarrhea can also come with cramping, abdominal pain, bloating, nausea, or urgent need to use the toilet. In more severe cases, you may see fever, blood or mucus in the stool, or signs of dehydration like dizziness, dry mouth, or little urine output. Children and older adults are at higher risk of dehydration, which can be dangerous.
Dehydration sounds serious. How can someone tell if they are becoming dehydrated?
Signs include feeling very thirsty, weakness, dry lips, reduced urine or urine that is dark in color. In infants and small children, warning signs include a sunken soft spot on the head, no tears when crying, or being unusually sleepy. Dehydration is one of the biggest dangers of diarrhea, especially in children.
If someone has diarrhea, when should they see a doctor?
Good question. Most mild cases get better within a few days. But you should see a doctor if diarrhea lasts more than 2 days in adults or more than 24 hours in children. Also, if there is high fever, severe abdominal pain, blood in stools, black, tarry stools, or signs of dehydration. For infants and elderly people, don't wait too long. Seek care early.
How do doctors find out what's causing diarrhea?
The diagnosis starts with medical history and symptoms. If it's mild, testing isn't usually needed, but for severe or prolonged diarrhea, doctors may order stool tests to look for bacteria, parasites, or blood. In some cases, blood tests or imaging may be done, especially if a chronic condition is suspected.
Now, let's talk about treatment. What can people do to feel better?
For most people, the key treatment is hydration. Drink plenty of fluids, water, clear soups, or oral rehydration solutions that replace lost salts and electrolytes. These are especially important for children and older adults. Eat small, light meals. Foods like rice, bananas, toast, applesauce, and potatoes are gentle on the stomach. Avoid greasy, spicy, or very sweet foods during diarrhea.
And what about medicines?
Sometimes doctors may prescribe medicines for severe diarrhea, depending on the cause. But over-the-counter anti-diarrheal drugs are not always recommended, especially for children or when diarrhea is caused by certain infections. That's because slowing the gut may trap the germs inside. Antibiotics are only used if tests show bacterial infection, not for viral diarrhea.
So, the message is don't rush for medicine, focus on fluids, rest, and only use treatment when a doctor advises.
Correct. And let's talk about prevention. Most diarrhea can be prevented with simple habits. Wash your hands regularly with soap and water, especially before eating and after using the toilet. Drink safe, clean water. Make sure food is cooked thoroughly. Wash fruits and vegetables well. Be careful with street food in places where hygiene may not be reliable. And when traveling, be cautious. Avoid unpasteurized milk, raw seafood, or untreated water.
Those sound like small things, but they can prevent a lot of illness. Doctor, can we give our audience a quick do and don't list?
Of course, do drink fluids, rest, eat light meals, and seek care if symptoms are severe. Don't ignore dehydration, self-medicate heavily, or eat fatty, spicy, or sugary foods during diarrhea.
That's very practical. Let's summarize for our listeners.
Of course, diarrhea means frequent loose stools. It can be caused by infections, food intolerance, medicines, or chronic conditions. Symptoms include watery stools, cramps, nausea, and sometimes fever or blood. The main danger is dehydration, especially in children and the elderly. Diagnosis is based on symptoms and sometimes stool tests. Treatment focuses on hydration and light diet. Medicines are used only when necessary.
So, while diarrhea is common, it doesn't have to be dangerous if we recognize the signs and take action early. Knowledge is protection.
Exactly. With care and prevention, most cases can be managed well, but never ignore warning signs. Your health is too important.
Thank you, doctor, and thank you for listening to Dr. Health Hub. Don't forget to like, share, and subscribe for more trusted health tips. And remember, your health is your wealth.